Last week saw the second presidential health summit. It came up with reports that the Gauteng Health Department was battling to get enough food for patients at the Chris Hani Baragwanath Hospital. The Treatment Action Campaign told you on this program last week that patients were relying on food from their families and on their friends to bring it in. But the Gauteng Health Department says no patient went without a meal. The Gauteng Health MEC, Nomanto and Komorana Hoko, said last week she had made progress in improving the finances of the department. Dr. Mvuyisi Mzukwa is the chair of the SA Medical Association. Dr. Mzukwa, good afternoon to you and thank you for your time. We keep hearing of big summits like this, a presidential summit on health to fix the public health system. Do these summits do anything to help the situation?
Good afternoon to you, Steve, and to your viewers, and thanks for having me. Steve, we are happy that there is some summits that are going on, but I can assure you that the government is only bringing in their ears, but they leave their hands at home. They will be there to hear out what the stakeholders are saying, coming up with solutions, to the healthcare issues. But they will never implement even a small thing, in those discussions. So to me and to the association, we feel that honestly it is a waste of time to be attending this summit when there is nothing on the ground that is happening. You can't believe that, since 2018, we're still talking about food shortages in the hospitals. I mean, what do you call that? And you're at the same time promising people big things like the NHI when you can't provide a simple food on the table.
So, I mean, are you saying that patients aren't being looked after properly? What are your colleagues telling you about the situation? What do you know about what's happening in the public health care system? Is the Gauteng Health Department not delivering what it says it's delivering?
Yeah, Steve, it's not us, it's not our colleagues, it's also the health ombuds who issued out a report, highlighting some of the issues that are facing the healthcare system in Gauteng. And actually, it's not only confined to Gauteng. Other provinces as well, they're suffering from the same, but it might not be at the same degree. But what we see in Gauteng is a poor administration, political encroachment, and everything else that you can imagine. I mean, where in the healthcare system you can even buy skinny jeans, whilst people are suffering, whilst people are hungry, you can just have an order like that. And it's not only that. That there's been life epidemic. There's many scandals that have happened in that province, but you're still talking about summits. So the next summit, I assume it will be next year. It means we keep having summits, or in the next 5 years, we'll have another third summit and will not achieve a thing because there is no implementation.
Is there any sign at all that the situation is going to improve? I mean, government's talking up the NHI. They say that will change everything. Really what it will do is allow patients without medical aid, without money, to go to a private hospital and government will pay for it. I mean, is that really going to work?
Steve, I think we need to always correct this thing of the NHI. The NHI speaks about pooling of funds. It's a finance system that enables, the healthcare system to run. But if you look at all the elements of the healthcare system according to the World Health Organization, you've got governance and leadership. You've got information system, you've got human resources. All those things, they make up a healthcare system. So the NHI doesn't speak to those things. And what we are struggling with now, we are struggling with, leadership and governance. Right from the National Department of Health going down to the institutions, there is absolutely no leadership.
What's it going to take to change it? I mean, we keep hearing promises. We've had promises for years and years and years. I mean, is there anything that you think will lead to a change?
Like I always suggest, sometimes it's important to, as civil society, to get together and hold government accountable in terms of dragging government to the courts if they cannot oblige to, their responsibilities, constitutional responsibilities. We have to do that at some point. But I do believe at the moment we're still hopeful that if we negotiate and some sense, will prevail in the Department of Health and in government in particular.
Dr. Mvuyisi Mzukwa, thank you, Chair of the SA Medical Association. Really appreciate the time.